Hello, I'm Jess Eddington. I'm the Administrative Assistant here at Indy Women's Counseling and DBT. In this video, we will discuss how you can use your out-of-network benefits to meet with a therapist that is considered out-of-network. First, let's consider the difference between in-network and out-of-network. The only difference is that the in-network therapist has a contract with your health insurance. This means that after the session, the therapist you meet with or a member of their staff will contact your health insurance to receive the payment for that session and then charge you for whatever is left, depending on your insurance plan. When you meet with an out-of-network therapist, you pay for that session at the time of service with a credit, debit, HSA card, or cash or check, and then you seek reimbursement from your health insurance afterwards. Out-of-network reimbursement varies depending on your insurance benefits. Some get 50, some get 60 to 80%, and some can get as much as 100% back from their health insurance. So the first question to ask yourself is, do I want to use health insurance? When you use health insurance, of course they want to know the reason why you're going to therapy, and that becomes part of your permanent health record. Most people are totally fine with that, but some people don't want those diagnoses as part of their permanent health record, usually for employment reasons. There are any number of other reasons someone may not want to use their health insurance for payment. If that's the case for you, then we can help you work through that. This also gives us, as the provider, more flexibility to look at sliding scale options if therapy is not affordable for you. But if health insurance is something you want to use, the best place to start is to call up your health insurance and ask, specifically, I want to meet with this provider and this is the rate they charge. Exactly how much will I be reimbursed for each session? We never want you to get into a situation where you didn't know exactly what to expect with payment, and sometimes that can happen with insurance if there is something that you didn't understand ahead of time. So we encourage you to call and just make sure you understand everything that's involved. Our website has all our rates of service under Rates in the About tab. If you want to meet with one of our providers, you can use this when you call your insurance to clarify what your out-of-network reimbursement would look like. The summary of benefits is also a great starting point, and I have an example here. This one is somewhat typical, but there's such diversity and each plan can be so wildly different that this is just an example of what it could look like. You would look for your mental health coverage, and then within that, your outpatient visits. So with this example, if you were to meet with an in-network provider, you would have a copay for the first 8 visits and then a $75 copay for any visits beyond that. And then of course your health insurance would cover anything that's more than that $75 copayment. But then if you were to do any out-of-network provider, they have a 30% coinsurance. That means that you are responsible for 100% of the payment at time of service, and then your health insurance will reimburse you 70%. So if you meet with a therapist that charges $100 per session, you would pay for that $100 with whatever form of payment at time of service, and then when you seek your reimbursement from your insurance company, you would get $70 back. So you would end up paying $30 per session after reimbursement. For this example, it would be a much better deal financially to meet with an out-of-network provider than meeting with an in-network provider at a $75 copay. If you were to meet with an out-of-network provider that charges $200 a session, you would get reimbursed $140, and so you would be paying $60 per session. And so then that's more on par with any of the in-network providers, especially if you were to meet with the therapist more than 8 sessions, then it would be about the same. Some insurance plans tend to favor in-network providers, but oftentimes the in-network versus out-of-network benefits are comparable. Another thing to be aware of is your yearly deductible. Often, mental health services are not covered until the deductible is met. Sometimes the deductible is different for in-network versus out-of-network. Sometimes both in-network and out-of-network are included, and sometimes it's only out-of-network that needs to meet that deductible. In that case, then you're not receiving any health insurance benefits until you meet your deductible, so you might as well choose a therapist that's the best fit for you. Another important thing we'll touch on is something called a Superbill, which is the document you receive from your out-of-network therapist. Your therapist has all the information that you need to submit your claim to receive reimbursement from health insurance. That includes your provider's license number, their tax identification number, and their contact information, as well as your mental health diagnosis or diagnoses and the CPT code. The CPT code is the code of whatever kind of therapy you receive, whether that's group therapy, individual therapy, couples therapy, or an assessment. Here is an example invoice directly from our online client portal. As you can see, it has all the necessary information to use for reimbursement. To access your invoices on the home page of the client portal, click on Billing. You can then click on the invoice you wish to view and then click Print at the bottom of the screen. This will pull up a preview of the invoice, which you can either download and save to your computer or print from this screen. As always, please reach out with any questions. You can reach us at our main office number that can be found on our website at indywomenscounseling.com. Please let us know if there's any way that we can help you in this process. Thank you and take care.